when I was like 10 years old. I've had this like interest towards nurturing and caring and helping others. Hi, my name is Rose Fejerang. I work at San Francisco General Hospital. I am a respiratory therapist. I've been there for 16 years. On a day-to-day basis, we are working alongside physicians, nurses in our ICUs, critical care environment where I help folks breathe when they're having a hard time breathing.
Rose always contributes to a calmness. Definitely, she brings a sense of humanness. When the pandemic first started and we started seeing patients come in with COVID-19, she gave her all to the patients as well. I mean, you know, we all did, but Rose, she's really wonderful.
COVID-19 is a virus that affects your respiratory system. Most of the time, we need to give them a lot of oxygen right up front. We need to find a way to support them the next few hours because it goes really quickly from looking really good to then all of a sudden needing to have a breathing tube in place.
She's very compassionate with our patients. She's very thorough and great about educating them and making sure that their needs are going to be met even when they leave the situation that they're in.
Anytime you see, you know, someone right in front of your eyes not being able to take their next breath, you know, there's definitely just some heartbreaking that happens, you know, the minute they come in talking, laughing, speaking to us, and then to see them not come out of it, right? There's definitely been a lot of days of just like, well, what did I do wrong? What could have I done better? And feel really defeated in so many ways. And, you know, seeing the death toll numbers just going up everywhere, I imagine every healthcare worker working in this through this pandemic has had multiple heartbreaks and, you know, has felt very defeated for the last year and a half. I think I always go back to just loving what I do, knowing that this, you know, being in healthcare is one of my life purposes of being here. I knew that, you know, I had the ability and the resources and the support to do what I do, but that I also needed to help my coworkers and the community that I was living in.
Rose Fejerang helps people breathe. With the country still battling a lethal virus, it takes direct aim at the respiratory system. It's hard to imagine a job description more important than that. Rose's patients are lucky to have her on the very front lines of this public health crisis. If you work with someone like Rose, who does their job with courage and compassion, who never lets up in their desire to do their very best for their communities, we want to know about it. Go to this website and nominate someone for a Never Quit Service Award today.